Circumferential-Surrounding Meniscal Repair, a salvage technique to save the meniscus, by Instituto Cugat. This is our conflict of interest. We present a case of a 14-year-old male with a bucket handle meniscus tear with an associated free flap of the posterior horn. We begin with a regular diagnostic arthroscopy. Here we can see the free flap and the meniscus that is dislocated. Once we confirm the ability of the meniscus to be reduced, we have to begin with the meniscal repair. Here we can see the free flap that can be put back to the posterior horn, and then we create an accessory anterior portal to have a better angle for the meniscus repair. We begin with the first circumferential surrounding repair into the posterior horn closest to the midline. We go above the meniscus, all the way around and below the meniscus, and then we tie the suture down so that we create a meniscus that is packed together into the capsule. Next step is to repair the free flap. Here we see again a circumferential surrounding repair, and then once this is done, we perform a side-to-side repair of the free edge that will be sutured back into the posterior horn. Here we can see the knot being tied down so that we stabilize the free edge. The next step will be to reduce the bucket handle component. In this case we use a grasping that can be kept in place to keep the meniscus reduced from the anterior portal while we repair from the accessory anterior portal. Here we perform several circumferential surrounding sutures, again going above the meniscus into the capsule, all the way around, below the meniscus into the capsule, and then tying the knot down so that we pack the meniscus. This is also helpful for horizontal cleavage, to pack both segments together. We perform several of these sutures so that we end up with a stable meniscus. Here we reinforce the first stitch that was a little bit loose. And then, for this particular case, because the meniscus was torn up into the body, we have to repair this segment as well. We continue with an all-inside meniscus repair into the corner between the posterior horn and the body of the meniscus. And then, once this is tied down, the body is reduced, and we have to incorporate outside-in repair to be able to finally stabilize the body of the meniscus. This is done with 2 spinal needles and a PDS used as a transport suture to place an ultra braid that will be tied into the subcutaneous area. We put the second one here so that we have the full body of the meniscus stable and repaired. Here we have the final result of our repair, confirming that the meniscus was saved and was stable for this 14-year-old male. A complete description of this technique can be found at arthroscopytechniques.com. This is our entire group, and we thank you for watching this video.